Yeah. All right. So we are here today with Mr. Serene Gaye, and Serene is part of the iMedical equipment team. And Serene heads up and runs a lot of our international projects, especially a lot of the projects in Africa, in addition to a lot of the contractual things going on with healthcare providers, rental contracts, a lot of that stuff. I mean, actually, Serene, you've got a lot that you work on and do with iMedical. Do you want to go ahead and just give us a little bit of your background, how you got in the industry, and some stuff that you've worked on in the past that's kind of brought you into the healthcare industry as a whole?
Perfect. Yeah, thanks, Sean. Thanks for the opportunity for the interview and stuff. This is a long time coming.
It is.
Yeah, as you mentioned, I'm part of the iMedical organization. I'm a partner and the chief strategy officer. And with that, I wear many hats, as Sean mentioned. So I lead the contractual uh, um, verticals, as well as the international uh, contracts and endeavors and or adventure, if you want to call it that way.
Hmm.
So prior to joining and the new team, getting iMedical created and be a partner, I was an AVP system director, but essentially an AVP level at the Bon Secours Mercy Health, where I led the capital team and then led the clinical engineering team as well. So I have a background also in engineering and then biomedical. Uh, so that's my background. So with that, we got a lot of experience in medical instrumentation and medical clinical equipment in general, and all the processes that goes with it. So that's in a nutshell. That's my background. So recently, we've been working with a lot of projects overseas as well as domestic with
Yeah.
big ADNs. So
Serene, before you get too much further, I want to drill down a little bit. So with Mercy Health Group, and you basically were the person that set up a lot of the purchasing, like a lot of the contracts and the purchasing for what equipment was going to go into the hospital, reviewing, the equipment itself, because you have a biomedical background, engineering background, you obviously know the equipment very well. So you you kind of breezed through that, but that was a really big responsibility because those were some very big dollars that you were spending there. Can you just talk a little bit about that, or just give a little bit more information of kind of what that involved for you on some of the contracts and projects that you were handling for purchasing equipment?
yeah, so during my tenure there at Bon Secours, so I had different roles. So the first role was capital procurement. I was the system director for capital procurement. In that, you're right, I was responsible for capital buying and then the capital process in general, right? Anywhere from the capital management refresh, which is the cycle, and the procurement of it. So we had a clear 3-year plan, replacement plan of capital items, and we start to that plan using some capital tools such as Strata, Jazz, and getting the planning all the way to the execution with the procurement team, the capital procurement team. Um, that was, to your point, multi-million dollars, and it stems anywhere from imaging equipment to general biomed to just your regular beds. And I oversaw some of the standardization process where we standardize the utilization of specific modalities such as beds across the entire ministry. So the example was, standardizing the beds to just Striker that optimize not only utilization but also help with the service side. Because if you standardize one vendor for a specific modality, it helps in a various ways, right? Anywhere from the cost of ownership of the equipment, because now you're having one vendor, one model. So it's easier to maintain because of that redundancy you create. And then it gives you an upper hand when it comes to negotiating with the vendor and acquiring those equipment. So in a nutshell, that's what I did there. But that was one of the roles. The other roles that I had later on was overseeing the clinical engineering program for the entire ministry.
Mhm.
Although we had a third party handling our clinical engineering program, but I had responsibility over that third party, managing anywhere from the overall transaction or what that program looked like and what it entails and what was the day-to-day operation.
Mhm.
So yeah, and to
So,
summarize, that was the two roles, the main roles that I had there.
right. And
Nurse.
so now here with iMedical, we are, we're greatly expanding our international presence around the world, Latin America, um, areas like India, Pakistan, and also Africa. And you have been instrumental in a lot of these massive projects going on right now in Africa. And that clinical background that you've got, because I know when we're setting up these projects with hospitals overseas, the key word that you brought up there is standardizing, right? So if we're setting up a hospital and we're talking, say, monitors, GE, everything in that hospital is going to be GE. Everything, you know, for the new hospitals and the projects that you're taking on overseas is going to be structured exactly the way hospitals are doing it here in the United States. And that background that you've got is it's priceless really when it comes to helping out new hospitals and large projects. And we do a lot of private hospitals, right? But we also do a lot of big government projects. And you've been really the guy behind the scenes that's really helped secure a lot of these projects. Now I know we've got a lot of projects going on with various countries over there. Do you want to start off with we'll just say with Sierra Leone and what's going on there and what iMedical has that they're setting up and kind of what is the current set of projects that we're working on over there?
Yeah, sure, Sean. So we have various engagement currently overseas, especially in the African continent. That's in, involve multiple countries. I mean, such as Mauritania, Sierra Leone, Guinea, Tanzania, and Senegal, to just mention those. We've specific to Sierra Leone. We were there recently, a couple of months ago, met with some government official, the vice president, the Minister of Health, and some other ministry. Visited the healthcare system in the country, and I got a preview of what the healthcare system is like there, and also did get a preview of what the country needs. We were given the opportunity to kind of bring our expertise to helping develop the healthcare sector in Sierra Leone.
Mhm.
And in that, we were offered to build hospital, which is in our purview. As you know, iMedical is a multifaceted company that hand, deal with not only sales, service, uh, consulting, planning, and construction of healthcare facilities, as well as the rental of medical equipment and then the consulting part of it that I had mentioned earlier. So with that, when you were approached by the Sierra Leone government, we went in there to just see firsthand uh, what the healthcare system was like. We also were offered to if we to build two major facilities, one woman and infant facility and a general hospital as well. So
Mhm.
we are working with our partner to put that plan together. The design, we in the design phase, and then go back and meet the official and propose that plan and go to the next step. Concurrently, we're gonna open up a iMedical branch there
Mhm.
and an iMedical clinic. a private clinic as well, to help kind of boost up the medical equipment technology level in that
Hmm.
country. Yeah.
Hmm.
So that's just for Sierra Leone. We are doing something similar in the country of Mauritania as well.
So Mauritania, there's actually 4 projects going on over there, correct?
Correct. So there's a 4 project. 2 is a building hospital similar, a woman and infant, and 1 oncology hospital, and 1 is revamping the uh, uh, the respiratory level, the country respiratory equipment level, I should say, when it relates to ventilators. So we are working with the Ministry of Health officials in those projects. Yes. So so we also in the design phase. We're gonna be soon uh, be providing the design for those 2 hospital and get the stamp of approval from the authorities and get to the next steps.
That is super exciting. And so we
And
did,
that's I want to add on the Mauritania side, Sean,
yeah.
it's just for the government. But on the private sector, we're working on major imaging deals related to MRIs and CT and bone densitometry systems as well. And
Mhm.
in there as well, we can open up another branch, which is a subdivision of the iMedical Africa, located in Dakar, Senegal.
Right. So, in fact, I do want to talk about Senegal because that was really for us. That was a big deal when we opened up that location in Senegal, Africa. And really, that was 100% based on your background and your presence there. Um, and so, Serene, you've talked a lot about the biomed, you talked a lot about us stuff, but let's talk about, you as a younger person, your experience with being overseas, because I know you speak what, like 5 languages?
Yes, yes.
5 languages. So you talked some of the business stuff, but let's talk about a little bit with you when you were younger, your upbringing, and the experience that you had living in some of these international places that gave you that skill set, and also really helped you understand the culture and have contacts over there.
Yes, sure, Sean. So, I mean, I come from a very clitoral background, and so uh, with my parents born overseas and stuff. So I was raised in different countries, and with that, it kind of forged who I am today because I was
Hmm.
exposed to different cultures. As you mentioned, I speak 5 languages, so, and given the background that my parents had with the various jobs they had, whether it was not domestic or international, also helped me be who I am today.
Hmm.
Uh, and that's what I'm trying to, pass on to my kids as well
Right.
with, speaking those different language, because I believe that knowing the language is also knowing the culture. So I'm fluent in Spanish, in French, English, local dialect called Wolof, spoken in West Africa, and a little bit of Arabic and Italian as well. So that kind of really helped me be who I am today. It
Hmm.
gave me a different perspective in life,
Hmm.
and also helped me, give me a sense of how to approach things, right? How to approach
Hmm.
processes, how to approach problems, and how to analyze things in general, right?
Hmm.
So I'm very proud of the upbringing my parents gave me, and that translate a lot into who I become today. Uh, you know, throughout my professional life and how I applied those values I was given
Hmm.
into my professional life. I mean, it is evident, and is people see it. People that really know me see what that impact that with my upbringing, how it had a big impact in my current professional life.
Right.
So to summarize, I mean, I would say definitely that upbringing gave me, I will not say the upper hand, but had a big influence to who I became today, and how I conduct business in my professional life.
Right. And I mean, I'm just going to say this as subtly as possible, but that upbringing with your parents not only gave you all that experience, all that background, and all these different cultures, but it also really got you tied in on how to work within government entities and the
Indeed.
process of contacting government entities, the whole, like, your family, your parents, having worked for various, in
Government.
government positions.
Mhm.
That really gave you a good background also then to sort of combine all the medical knowledge, all the engineering knowledge, all the information on how these healthcare chains are set up and how they work, and then knowing how to interface with these various governments around the world. And it's not just Africa. We're talking about Africa now because I think, ultimately, we really see that currently as probably one of the fastest growing markets in the world.
Right.
And we're at a place right now in the United States where there's a surplus of medical equipment, and everybody there is. We all know that a lot of this equipment has a lot of life left in it, but the real challenge is trying to establish those relationships to open up these secondary markets to get this equipment into places and into the hands of facilities that can still treat patients and give it a real good life and keep it out of a landfill. So you've been instrumental in that, and it's really a multi-tiered background with a lot of skills that have all sort of combined to really help develop for iMedical this growing market and be sort of the face of the company when we're working on some of these overseas projects.
Correct, Sean. You're absolutely right there. You hit the nail right on the head. So for Africa, and you mentioned it, we're not only dealing with the continent of Africa, but since it's one of the fastest growing markets, especially when it comes to healthcare, because there's a lot that needs to be done in that continent when it comes to healthcare. A lot so far has been done, but probably was not done the right way. So we are proud and humbled to be able to bring our contribution to that development. And you mentioned it earlier, given my experience and both on the family side or just over the years in dealing with government, we know how to approach different culture, different government, because every government is different,
Mm-hmm.
and every culture is different.
Mm-hmm.
So we want to position ourselves as iMedical to one of the major partners in the African continent when it comes to bringing up to par the healthcare sector, especially uh, for clinical equipment, but also for healthcare in general, anywhere for the whole continuum of healthcare, right?
Mm-hmm.
Anywhere from the buildings to the outfitting of the building to even the human resources. As you know, we have some partnership in the country here, the continental U.S., with several folks that are prominent folks when it comes to healthcare.
Mm-hmm.
So we can definitely also help uh, in that arena as well when it comes to the qualified human resource arena. So that's what iMedical is working tirelessly, and it's a team effort. I know I'm leading it, the thing, but it's a big team effort. You as our lead of on anything marketing and sales and anything really media, you instrumental as well. Thus
Well,
as the
Serene, that's why I got to get you on this call, man. That's why I've
yes.
been trying to. You're like the hidden person behind the scenes. I'm taking all the information and I'm kind of putting it out there.
Yeah.
But that's why I've really been trying to chase you down and say you really got to just give me an hour and let me just kind of put this out there because there's so many things that you do, but many times they'll see a lot of the information, but they might not see the individual people. And so for me, that's why it was
Behind it.
really important
Yes.
to kind of bring you out and say, here's the guy that's really making a lot of this stuff happen. And
Yeah.
you're actually providing me with a lot of the materials to do the marketing with. So I mean, I got to give credit where credit's due, right?
Yeah, it's a team effort.
It
So
is.
as you mentioned earlier, I wear multi hats. So one of them
Mm-hmm.
is, as you know, we are unique in our industry because we are multifaceted. So we
Mm-hmm.
have an IT division, we have a consulting division, we have the sales division for new and refurbished equipment. We have the planning and construction. So there's not a lot of company in the US that does what we do today. And we are present in the digital arena as well with all, soon to come, new project, digital
Yes.
marketing project that I'm not going to disclose here. That actually gonna revolutionize the industry, as you know.
That's the next video.
Exactly. So with that, we have the call center that a lot of company in our industry similar to us don't have. We have a
Mhm.
call center. We have like I mentioned earlier, an IT team. So we customize all our application. All the portals we utilize with our customers is customized to the customer need and
Yeah,
customized to how we tailor those contracts, right?
right.
So we do a lot of those different things, and we have a lot of people in the background working. And as one of the partners and owners of the company, I'm grateful that we have this team, and then we are very forward thinking. We are using emerging technology to get to the next level.
Yeah,
That's the key here.
yeah,
How are we going to impact the next level, right?
right,
How are we
right.
going to change it? Yes.
So I want to go back again and talk about a couple other things because the goal of this video is number one to introduce you and let people get to know you a little bit, but also talk more about the expansion of the medical equipment industry into international destinations and back, today primarily Africa. So you brought up a point, and there's a couple other things that I kind of want to fill in that go on behind the scenes. Now, in addition to the projects that we're working on with these international projects, we take on a lot of private projects as well. And I just had Linda Sesse on 2 weeks ago, Community Health Foundation Sierra Leone, which is a phenomenal story. I mean,
Indeed.
she basically built this clinic herself. I mean, she literally did the whole project herself. And so, she got up and running. But Serene, I do remember a time when Linda had all the equipment over there. The building was set to go, but she just had like that fear about, okay, I still have to figure out how I'm going to collect money, how we're going to pay people, how am I going to do the procedures? Where am I going to get disposables? I mean, there was a long list of things that were very small details that she had to get done before she could open that facility. And your background in the healthcare industry here in the States really helped her get those last small things put together to finally get her facility open. Like that was instrumental. I mean, she actually, you were overseas at the time. She was here, and she said, I'm not doing anything until Serene gets back.
Mhm.
So you were very instrumental in her. And so with these private clinics and hospitals that we've been able to get set up, I think the interesting story about Linda is that the government saw what a great job that we did on that
Indeed.
project and said, we definitely want to get these people over here to help us. I mean, and so you've been over there, you've seen Linda's health foundation, which now, as of 2 weeks ago, she opened in April, right?
Yeah.
As of 2 or 3 weeks ago, they'd already saved 62 lives in that facility within the first 4 months.
Indeed. Yeah. Yeah. That story is phenomenal, Sean, and we are so proud to be part of it. And as you mentioned, when Linda, I mean, she has the nonprofit organization registered in the States in the Community Health Foundation. She started that clinic by herself. We got her all. I mean, I would say all the equipment that we got her. We helped her as much as we could. But what we really did there was supporting her,
Mhm,
helping her, showing the way and how to do it. You can really do it.
mhm.
Pushing her. You mentioned she got all this equipment from us, but it was after another year or so that she really had the courage to go and start the clinic.
Mhm.
After we really talked to her, nurture her, really supported her, and
Yeah.
show her the way to get it done. So, and that's what opened the door to get it going into that country and meeting the officials. So when we went there, her clinic is located in mile 91. And mile 91 is at the crossroad, actually really crossroad of the country. It's located in the main, at mile 91 miles away from the capital, Freetown.
Freetown, right.
Yeah, and it's next to one of the major private university called Canadian University that her brother
Her
funded as
brother,
well.
right.
Exactly. So it's a family of entrepreneur and patriots that love their country and really bringing their contribution to developing that country. So when we went there, I was very proud of what we done with the support and the equipment we provided to her, and how she was able to hire all these peoples. And then I think shortly after our visit, her clinic was but to another higher level. I think she started as a critical care hospital.
Yep.
Now she's a regular hospital, right?
Yeah.
And you mentioned it, as of what, a couple of weeks ago, she saved 62 lives.
62 lives.
Yeah, they're performing surgery.
Yeah.
They're doing labor and delivery. I mean, they're doing hospitalization. It's
right.
amazing. Yeah, and we tend to partner with her because they're building a new wings. iMedical, we're partnering with them and really making it a full-fledged healthcare institute. Yeah.
Right. And so now she's starting to break ground on 110 patient room hospital, right?
Correct.
Because what they figured out is when you set up a medical facility, even though she primarily wanted to be OBGYN and labor and delivery, you're going to get people all from the area that come there for a multitude of different things. So you ultimately have to be very versatile so you can treat and take care of, like you said, any type of situation. And I know that, from talking to her, that the doctors have done hernia operations. They've done a lot of other types of surgery that was not really in the scope of the project when it originally developed. But now with the success and with the overwhelming support within the community, now she's going to that 110 room facility, which, God bless her, she's going to do it. But the thing about that also, Serene, which is really a point to be taken, is that these projects that we do in Africa are really the compilation of years and years of all these types of projects with these private hospitals that we've done. And there's dozens of them because what happens is that we get Linda and then she meets with Modesta and we get, Modesta runs the 115 or 120, actually 130 room hospital in Kenya, right? Just outside of Nairobi. And so we get all these people that have had experience launching these projects. And, they all are they all able to provide some type of assistance with how you're going to run it, how you're going to need to manage it, all these different things. But I think the key thing here for us is number one is the projects, the stuff that we're doing right in Sierra Leone, but now having the established relationships and people in place to actually set up iMedical locations in these countries. Because as you know, and I know, not everybody out there that needs medical equipment has enough medical equipment to fill up a 40-foot container. So there's a lot of smaller clinics, a lot of facilities out there that might just need an ultrasound or a couple infant warmers or maternity beds or beds. And now they can come to a facility where we're going to have all that equipment available. And so that for us, from a distribution of medical equipment standpoint, is huge because it's much more cost effective. People do not have to be scared about sending their money overseas to people that they don't know. Figuring out, if you're shipping a full container, it's gotten expensive, but it's way more expensive to send 3 or 4 pieces. In some cases, as you know, you might send 6 or 7 or 8 pallets of stuff, which would be a third or less of a container, and pay the same amount you would for a full container. So for us, from a logistics standpoint, having these foundational locations now, Senegal was instrumental, and that was our first stop right there. But now getting a location set up in Mauritania, and now this location that we're going to be setting up in Sierra Leone, that is going to open us up now for all these other smaller clinics and private hospitals to be able to source equipment. And since you know that area so well, maybe you could elaborate on what, like the way that that's set up. You can get Ghana or you can get other countries being able to just cross the border, come into Sierra Leone and be able to purchase their equipment now.
Correct. So the idea is access, as you mentioned earlier. it's access and distribution, right?
Hmm.
Right now, when folks want quality equipment, I mean, remember those market are flooded with Chinese product. Can be flashy, but don't last. It's not. The U.S. being the number one country when it comes to medical equipment by far in quality, by far, even if you compare to Europe. So people, want to acquire medical equipment from the U.S. from companies like us. So having a local, branch there and where they can go to and get access to this quality equipment is key. So as you know, it was a long time coming putting together Senegal. We're putting it, and then we started it. COVID hit. We put it on pause, but Senegal is the main hub for whole Africa.
Hmm.
So the location we're opening to Mauritania is a sub location for Senegal where we
Hmm.
can provide support, engineer or technician, or any other support. Anything that we can funnel through Senegal will do. The majority will come directly from the U.S. In Sierra Leone, it's different. It's going to be a separate, although the location Senegal can have, they'll oversee that as well, but
Hmm.
it's going to be a kind of autonomous entity where they can provide also support to those neighboring countries, as you mentioned, the Anglophone countries, the English-speaking countries nearby. That's
Hmm.
the key, because we have a lot of doctors and nurses from Nigeria or Ghana that practice in Sierra Leone. So
Hmm.
the idea is to provide that unique local place where they can get not only the expertise, but get the quality equipment they need. So
Right.
that's the idea behind it. But the location in Senegal is the reason why it was called iMedical Africa. So you kind of oversee all of them. The next step will be Tanzania. Given the distance in East
Hmm.
Africa and West,
Hmm.
Tanzania will be the next location in the capital Dar es Salaam, having a local presence there that can also help serve Kenya or any other neighboring countries that actually really always are looking for quality medical equipment.
Right. And that once again, that's really part of our global expansion program is to get these locations
Mhm.
into the areas that have the most need and then set it up in a way where people, because that's really one of the things that iMedical has done. That in some cases others have, but not probably at the scale we have, where it's like put all the equipment on display and bring people in and let them demo it, and
Mhm.
get two or three racks of monitors and say, all right, which one do you like? And exchange, the different sizes with the different models, with the different price ranges. And so when you set up that business model overseas, because ultimately our industry is kind of a show me, don't tell me. And as much as we talk about all the equipment, there's nothing better than letting people come to a place where they can test drive and sort of get their hands on it and walk out of there knowing that they're getting high quality stuff that's biomed certified. Um, you and John have been instrumental in a lot of the things that we're doing now, which is other branches of the company with getting into cables and SpO2 sensors and a lot of those things. So, when you're talking about quality and you're also talking about presentation, you're talking about giving them equipment that when they see it, you've got a bag of everything brand new and really giving them super high quality stuff. And as you touched on earlier, the quality of the medical equipment here in the United States is second to none. And so even though there might be a new model of a monitor that came out, or maybe, there's a new endoscopy system that just came out, we still know that a lot of this stuff, and personally from being in the hospitals in these chains, that these products still have a lot of life left in them.
Indeed, yeah, they have a lot of life left in them, and given the way the healthcare and the hospital in general is structured in the states, uh, a lot of the equipment don't, go to the end of their life cycle. So
Hmm.
before that they are replaced. As you know, each healthcare system in the U.S. have different equipment replacement cycles. I mean, they don't base it to really the HA guideline. They can retire stuff before the end of the cycle or the useful life of that equipment. So there's a lot of the equipment we get still have a lot of useful
Hmm.
life left on them.
Hmm.
Not only that, but then after when we take it and recondition that, it adds to the life of the equipment. So
Hmm.
basically, just add 2, 3 to up to 5 years to the useful life of the equipment, and that's what's so interesting. So the equipment we offer to those market, I will not use the term refurbishing, but it's reconditioned to the
Hmm.
iMedical standard, which is a high standard, ISO type standard. So once we give them that, they know that they have equipment they can rely on, then actually they can last them longer. It's not
Right.
just about a shiny piece of equipment, but it's two. I mean, not only shiny, but also that will last long and will help them get those clinical diagnostic that they looking to get by using those pieces of equipment.
Right. And Serene, with your background, and I dabble in this a little bit with some of the stuff I'm good at, which would be more bed stretchers and that type of stuff. But in addition to that, we also know what equipment we're not going to send.
Sure.
We're going to send all the good stuff, but if we know that there's a certain model or a certain brand that's notorious for having problems, that stuff more than likely we're just going to scrap it or part it out. That's never equipment that we'll send overseas. And I know in the bed industry, the total care sport, which is a popular ICU bed, as much as I love that bed, I know that that bed has the propensity to have hydraulic issues,
Sure.
and that's not a good fit for an overseas hospital. You want to give them stuff that we know is gonna be easy to work on, that's gonna have very few, if any, breakdowns whatsoever. And so, there's a lot of things that on your expertise level that that's not an option, that won't even get a chance to.
Mhm.
Um, and to kind of segue over, as we've developed this marketplace and as we've developed these projects, a couple key things that you've also really been instrumental in is, number one, service and training, right? So making sure that when we install equipment into these international hospitals, you or Jose or somebody is over there and they're going to train the staff on how to use the equipment. They're going to train the biomed folks on how to do the repairs. And as an example, they get 25 or 30 monitors. We're going to throw 2 or 3 or 4, whatever, depending on the quantity, some extra monitors over there so that they have parts units, they have a replacement unit that they can put in a loaner to kind of put it into the fleet and then pull one out and fix it, and then still have access to Zoom calls. And you were
Mhm.
very instrumental in setting up our training facility here in Virginia Beach, where these government entities and private entities can send their biomed people over here and get training specifically on the products that they're purchasing, so that they're trained to do the service part of it as well, which anybody can sell the equipment, but you can talk about that. That's you
Yeah.
know that we all know
Uh,
that, but talk about the service and that other part that we've developed.
And absolutely, you're absolutely right, Sean. So, and to mention, to just tap into what you just said there last before you segue. So we're not about just selling any type of equipment to those market. We always make sure that we match, it's the right fit approach.
Mhm.
We are very conscious about the cost of ownership, and if we send them a problematic system that we know they're going to have an issue with, or they're going to have issue with getting parts, so we always keep that in mind. So
Right.
we always do the right fit approach when it comes to what model and what brand we want to send for any modality, right?
Right.
So, um, and it's not just a matter of just selling them a piece of equipment and throwing them to the wolf, so to
Mhm.
speak. We sell them that piece of equipment, and also we help them with the support piece. What we learn overseas, they know how to buy equipment. The government or private entity will budget certain dollar amount and just go on a shopping spree and buy equipment. A year later, they have to redo the same thing.
Mhm.
So there's two problems there. First of all, probably they didn't buy the right piece of equipment. But the second, the biggest problem is the support piece.
Right.
And that's where we come in. That's why in our call center, we have a support division that where once we go live with this project, we're going to provide them support with biomed
Mhm.
and the other line at the end of those lines when they can call for support. So when we go and install a piece of equipment, we give them additional parts and we let them know that parts are available. We will continue supporting them, not only in that warranty phase, but post-warranty also, where we can dispatch engineers, whether it's from the US or just technician from the Senegal hub. And that's key. And because today there's not a lot of expertise when it comes to medical equipment repair in those countries.
Right.
That's the biggest hurdle they're facing. I mean, whether you go to Mauritania, Senegal, Guinea, Sierra Leone, is a recurring theme that we have an issue with servicing the equipment.
Right.
There's not a lot of preventative maintenance, and there's usually on demand, and even the on demand doesn't meet the OEM specs, the OEM requirement when it comes to bringing those equipment, repairing them, bring them up to par.
Right.
And that's where we come in with our service team, not only just on the service side, but on the training, as you mentioned. We have a training facility that we build from scratch. That training facility can provide a platform that can not only train clinicians on how to use a piece of equipment, but also the service teams, right? Those service teams help them on how to troubleshoot and how to give them the step-by-step.
Hey, we've got a guest
process.
right here that wants to jump in and say hi.
That's John Taylor, one of the other partner and CEO of the company. So here we are, one of the three instrumental folks. Yes.
You came in the conference room like, I got to get him in here, man. We got to have a little, just a little hello to jump through here, just to keep things light. He's working. Okay.
Exactly.
A cameo appearance from John. All right, that's great. I'm sorry to interrupt you there.
But... No, that's fine. That was a real genuine moment.
So
this
Serene,
is what iMedical is all about.
That's right. That's right. And when you're talking about that, the thing that, like I said, we've got so many projects going on over there, and a lot of these private ones are so essential to helping us, set up and show a lot of these governments what we're capable of doing. But what came to mind when you were talking about that is our one of our projects that we just were working on was that project that you were working on with Dr. Crispin, which was like 25 or 30 dialysis machines. And those were the Fresenius, and we had to get those, obviously get those recertified. But the thing that you had to set up on that project was once they got over to Tanzania, they had to go through being recertified because the shipping and bringing them over there. And I know that we were working on a couple projects with Dr. Crispin and with his partner. One of those was Somalia, the other one was Tanzania. But that was a project where, you're dealing with dialysis. That's kind of right up there with anesthesia and other things that have to be done perfectly because of the level of what those things are doing. So that was a project that you personally took on yourself, got all the recertifications done, got them all ready to go, but then also set that up so when they hit ground in Tanzania, when they got into port there, into Kenya, going to Tanzania, you had to get the team set up to, to get those recertified and make sure that nothing got upset with those during the shipping process.
Correct. Yeah, that was an interesting project, to say the least. And that's why it's key that when we set up those different locations in Africa, we also train local technicians that actually are linked to our main engineer here and are trained to the same standard. So when we send this equipment and we got to do local certification, not only we can dispatch an engineer from our Virginia Beach location, but also we're going to use local expertise that we were trained that are in the iMed payroll. So our technician to provide those certification to make sure that those pieces of equipment are up to standard and meet OEM recommendation prior to clinical use. Definitely. So that's the other thing that iMedical, we proud ourselves that we're doing today that a lot of the company in our industry don't do today, is that support, that whole continuum when it comes to the support piece, right? Yeah. It's not just that fiduciary transaction where we just sell you stuff and we say bye-bye to you, is that whole support
Yeah.
from getting it to you, setting it up, and helping you using it to the end of the life cycle until you need another one.
So I have to laugh because this industry, number one, it's so crazy. There's so many different things we deal with. Some of these projects, it's like, oh my God, I'm so glad Serene's dealing with that. But you're talking about service, but you and Carlos, you guys have been over there. You've actually been one of the guys that's been on site to do things. And I don't want to bring this up without having a good laugh, but that project that you did over in Senegal, right? Where you it was what, a mammogram? Was there a CT? What were you guys installing over there?
So we went to Senegal. I mean, actually, it was during the phase when we were trying to set up iMedical Africa in Senegal. We had that project when that was a mammo project, an imaging project with mammo and X-ray, where we traveled with our main senior engineer Carlos Mendoza, and but you're right. Thinking about it makes me laugh too, because every country is different, and then the time is everything, right?
It
You
is.
go there, especially during the summer when it's very hot. You gotta get used to that. I mean, where it was installed was not in the capital. It was about 3 hours away from the capital and stuff. So, you are faced with different condition that you got to take into account, right? That you didn't really plan for. So it's never easy. That's why when we do all these countries, we learn the lay of the land, learn about not the culture per se, but about the dynamics of that country or the dynamics of that organization we're dealing with, the local organization we're dealing with. This is key. So that's why these projects are not easy. So they are customized to not only each country, but each entity.
That's
because it might be one country and you're dealing with different entity. Each entity can be different from the other.
Yeah.
And then they all can be in the same location. So that's why our approach to customizing a project for the requested need for every customer is key.
Right.
That's what we pride ourselves.
Yeah. And the thing I wanted to touch on with that is that, number one is that there's a lot that you learn when you're doing these projects, right? Sure. I mean, I'm kind of laughing. We're laughing about it now because I know that there were some things that did not go as planned on that particular deal. But the thing about it is like you learned, it's like, hey, if I need a screw or something simple that might have fallen or lost, you know what? It's going to take me 3 hours one way, 3 hours the other to get a screw or get a very simple piece. And little things that along the way we learn, which is we're going to throw extra parts, extra backup stuff in there just in case, so we have some of that stuff. But part of this whole thing is a learning process, and that's helped us get better at what we do. And sometimes it's stuff that goes sideways where it's like, well, how's Serene doing? Well, he's going to spend the day going back into the city to get like a very simple item that, might have fallen out of the crate or somebody, because you do have some help there to kind of help take stuff out of the crates. I mean, obviously with the labor and manpower, there's multiple people that you'll bring in to get help with, but it could be something as simple as a basic screw, falling on the floor and rolling underneath a counter or something, and you can't find it, that now it's got this project on hold. So, I mean, I know for you when you're over there and it's 110 degrees and you're going, oh my God, where did this thing go? And it's like, okay, well, here's the option. We can't find it. And you got to drive, a day's worth of driving to go get an item that's very simple.
Item. Exactly. That we will take for granted in the States here.
Exactly.
I mean, so as you know, I wanted to personally, be involved in that project and oversee it. But you're right, we learned a lot of stuff. There's a lot of lessons learned. And that's why when we send stuff, I mean, not only we send extra parts, we make sure we have all the tools we need. Yeah. Because we're not going to assume that we're going to find it in the local market. And here, when it comes to medical equipment, we are so advanced compared to the rest of the world, and we are used to certain things. Just go to the hardware store and get what we need.
Yeah.
versus going to a country where you bring not only you bring a new piece of equipment that did not exist there. Now you're talking about trying to find a replacement part. So
Right.
you're right. And I forgot to mention earlier when I was talking about that ordeal there, that yeah, I had to go hours away to try to find some parts. So and that made us learn that
Yeah.
in the project, when we do any project, we want to make sure that all the tools that are required
Yeah.
is part of the project. It's what we're doing now with the project for Trinidad and Tobago in the Caribbean with that imaging project, which involves CT, ultrasound, cardiac equipment and whatnot.
Yeah.
In that, we're bringing all the tools we need, anywhere from the rigging tools to all the extra parts we need.
Mm-hmm.
And that's the approach that we're taking is unique when it comes really to our industry.
Mm-hmm.
A lot of people just will say, okay, we'll get into the local market, but we know we're dealing with those market, what needs to be done.
Yeah, yeah. And that's, it's part of the experience, right? But it's what makes you better. So as we deal with these things, then we can go back and say, okay, like you just said with the Tribago project, that's that brand new cardiovascular center, which is a big project. I mean, and that's a brand new facility. Everything down there is brand new. So now going down there, when we send people down there, from some of the stuff we've learned on other projects, we really dot the I's and cross the T's, and then just also go above and beyond to bring stuff that we might not actually ever use, but if we needed it, we would not have to go source it somewhere else.
True, exactly true. So I mean, it's just a learning curve and
Right.
learning all those experiences. Like I said earlier, I mean, every country is different. Every
Yeah.
entity within those countries are different. As you do this project, you learn the dynamics of those different countries and
Yeah.
the different stakeholders we are dealing with, and that just kind of add to our experience and kind of fortify us and help us in the direction we are taking, that forward-thinking direction that iMedical is taking,
Right.
to be one of the industry leader in this
That's
field.
right. That's right. So, Serene, I want to wrap this up, but before I do, I want you to give us a 12 to 18-month window of other projects, because I know you've got contacts, and I know we've been working and talking about opening up down in South Africa. But where is iMedical headed for the next 12 to 18 months with our African markets? Where do you see us going, and where other expansion and what other locations do you see us getting into over there?
Great question, great question, Sean. So our approach was going from, since we have a hub in Senegal, Dakar, Senegal, for iMedical Africa, is from that hub to expand, going from west all the way to east and south. So if you follow our expansion, we went from Senegal, we gotta go to Sierra Leone, which is southwest still, and then Mauritania, which is next door, north, and then we're gonna be going to Tanzania and then South Africa. And we want to, and then along the way, go through Benin. Not necessarily have a local presence, but we are taking on certain project. We received the 5 years plan from the Ministry of Health in Benin, and we are in the process of studying that as well.
What country was that?
Benin.
Benin.
Yeah, it's in Central West Africa, near Togo and Ghana.
Right
So
next to us, right next to Tanzania.
no. Actually, next to Ghana and Togo.
Oh,
Ghana.
gotcha. Okay.
Yeah. It's in West Ghana, Central Africa.
Okay.
So taking on some project there as well. I mean, this is just recent, as recent as a couple of weeks ago. We get their proposal, their 5 years plan, with all the different healthcare project they have, and they want to see how they can partner with iMedical to take on some of this project. So the 2 year plan consists of developing those. I mean, opening up the two locations we mentioned earlier, which is, I mean, around the corner, the location in Sierra Leone and Mauritania, and also take on the project in Benin, opening up the location in Tanzania, and then finally South Africa. Given the administrative hurdle in South Africa, it takes longer to really get our presence there. So, but that's in a nutshell, that's the 24-month plan we have for the African continent.
That is super exciting, very exciting. And, like I was saying earlier, I think that, a lot of these projects that we're doing are really exciting and they're big projects, but I really see a lot of the long-term growth and a lot of the potential coming from setting up on-site locations with a lot of equipment in it, where all the smaller entities out there have access to be able to just come in, purchase equipment and buy it and filter it out into all these other smaller regions around these sort of hub and base locations that we're setting up. Because just getting access to that equipment, being able to just drive a truck or something and pick it up and not have to worry about the shipping, the logistics, knowing at the time of the purchase that you're getting good working equipment because it can be demoed. That, for me, in addition to meshing with all these new big government projects, is super exciting. And you can't put a price on the feeling that we're getting, especially yourself and me and John and all of us, actually everybody that's part of this company, because like you said, it's a complete team effort. But when I hear stuff like Linda saying that within 4 months she saved 62 lives, and then we've got that big project over in Kenya now that's been open for a couple years. I'm just naming a few that just come to the top of my head. They had saved over 250 people. And Dr. Baker and Modesta, both are, I videotaped both of them. We've got those videos talking about some of the cases and some of the people that come in there that they've saved that never would have survived had these medical facilities not been there. So, technically, yes, there's financial stuff involved and there's a lot of logistic, whatever, but ultimately, once these projects are done, they're really, really helping people and they're saving lives. And I don't think of all the stuff that I could be doing, or you or any of us, I don't think there's anything more gratifying than knowing that all the work that we put in ultimately is helping people, saving lives and helping people live healthier, happier lives. And, all these international countries deserve it. As human beings, we all deserve that. But to be part of a company that's making that happen, I find that to be incredibly satisfying, and it definitely motivates you to go the extra mile at times where you might be tired out, or you might say, God, this project just seems like it's never getting done. But they do, and that's the kind of thing that pushes you through.
Indeed, well said, Sean. It's the gratification we get from doing this project and the impact that we make. It is a reason why we are called iMedical Healthcare Solution. We like to provide a solution to the healthcare problems that those countries have, and we are equipped both with the expert we have that this company has, and also with the equipment we deal with. So we can definitely make an impact, and that's the other piece. As although we are business, we in a business of making money, but we really our first and foremost reason why we're doing this is to impact in the life of others we are making. And that's actually personally for me, and I know it for you, for Gus, John, Mary, and everybody that works in here, is the impact we make in those people's daily lives. So we're gonna continue on doing that. We're gonna continue on expanding our footprint in those markets, both Africa, the Caribbean, South America, and do what we can to make our presence felt there, both in the public and private sector. It doesn't matter. Wherever we can make the impact, we will do, and we'll do it in the best of our ability. I know you mentioned it earlier. Those projects don't just happen overnight. It takes a long time. A lot of the stuff we work it for a year and a half, but it's just the nature of dealing with those markets.
Right.
And that's how we are. That's the reason why we are a nimble company, very nimble, because every market is different. So we got to adapt to that market and adapt to the custom and on the way of doing business in those countries and those entities. And we're gonna continue doing that. And like I mentioned earlier, implement the iMed brand in those countries.
Right. And it's really, for us, it's humbling because we live in the United States where we have access to very high quality healthcare.
Mhm.
But it's really satisfying. And I know, like you said, it's very gratifying to know that we're taking this equipment, this surplus medical equipment that has so much life, and giving it to the areas of the world that are in the greatest need, and figuring out a way to make a business out of that. And that is just absolutely, a phenomenal career choice. And I'm blessed to be with you guys. I'm blessed to be with you, John, Mary, Gus, everybody. And I'm so happy that I finally was able to get you to
We
talk about
finally
it.
did it, right?
And I do, Serena, I do have to throw out a teaser, because today we're talking about the emerging markets in Africa and setting up healthcare over there.
Mhm.
But we have some really big announcements that are going to be coming up. I'm not going to get too much into that right now because we do want to keep that as a surprise. But on a domestic level, there are some very big things that we're going to be talking about later. So I know, with this being said, we'll probably wrap it up right now on this video, but we will definitely be back in touch. And I
Indeed.
want to invite you to jump on a podcast with me and Chase,
Yes.
the bearded biomed. We're going to get Andrea and Gabriella. We're going to get some biomeds together, let you guys sort of talk shop, and talk about your most your favorite stuff to repair, and the stuff that you run from when you get a call for it. So we're going to share some more laughs and stuff later. But thank you so much for your time today. Um, I will
Pleasure
look
is
forward
mine.
to talking to you again soon. And take care, Serene. It's great to see
Thank
you.
you, Sean. It was great talking to you. Thank
All
you.
right, take care.
Take care. Bye.